Hello, I'm Associate Professor Bronwen Ackermann, and today I want to talk to you about an off-instrument retraining protocol that I developed with my colleague, Professor Eckhard Altenmuller, in order to retrain embouchure dystonia. So embouchure has been defined by Dr. Kees-Hein Woldendorp as the process needed to adjust the amount, pressure, and direction of the airflow as it travels through the mouth cavity and between the lips by the position and or movements of the tongue, teeth, jaws, cheeks, and lips to produce a tone in a wind instrument. Dr. Woldendorp has emphasized here some of the complexities in this interface between the mouthpiece of a wind instrument and the player's orofacial structures. What happens with embouchure in pedagogy? In pedagogy, although it is said that embouchure is a matter of such vital importance that its nature will influence the wind instrument player's progress and ultimate capability as a musician, there's no real consensus on how embouchure works. In fact, on the International Horn Society website, an instruction is that embouchure involves the player tensing the lips and face except at the center hole where the air is coming out. Many musicians believe that one shouldn't overthink the embouchure, and they talk about analysis equaling paralysis. However, if we look at research data, there's plenty of evidence to suggest that brass players will have facial and jaw problems in the majority of cases, up to 60% in Germany, and many other countries have replicated similar rates of embouchure dysfunction in wind players. So in embouchure dystonia, what we see is this loss of fine motor control, such as occurs in other task-specific dystonias of a particular body region, in this case the face, when they're executing complex and highly trained movements of playing an instrument. So what we see in this player on the right is a lot of facial movements that they don't want to make, that's making it very hard work for them to make the sound they want. Often, Professor Altenmuller has suggested that it comes at the end stage of a dynamic stereotype where movement dysfunctions are occurring, triggered or affected by multiple factors until they get to a point when they can no longer control these movements and get the tone that they want. At the moment, it's considered a very difficult condition to treat, this altered coordination of lips, tongues, lower face, jaw and breathing in brass and woodwind players. It's not really amenable to things like Botox. So we see this uneven lifting on the left side of this player. We can see things like tremor, and sort of puckering up of the chin that they don't want. Again, another case of tremor. There's a fundamental loss of stability along with the shifts. Or there can be deformities such as the lip movement, and this so we see all sorts of manifestations of embouchure dystonia. Why do we do off-instrument retraining? Well, the reason that I chose to do off-instrument is that there is, once you go through assessing the facial muscles of musicians, what you can notice is you can start to see imbalances, compensatory kind of patterns occurring if the challenges we're asking in the movements that are involved in this protocol, they're complex enough to trigger things that are like the dystonia, but it's off the instrument, it's more accessible, and we can break a movement down into components so they're able to work on it. The other additional benefit of an off-instrument exercise is that it removes the negative emotions associated with on-instrument performance degradation. So it restores feelings of them being able to get in control of these facial muscles without the stress of missing a note. However, there's at the moment, no explicit clinical guidelines on what to do with retraining for the embouchure, and so this was the purpose of our project. So in the first instance, with the retraining program, I established a screening protocol to make sure that we do assess the jaw, teeth deformities, lip abnormalities, respiration mechanics, and of course, a full assessment by an expert neurologist to make sure that the condition is appropriate for treatment. And then starting with simple orofacial movements, accessing all the muscles involved in the embouchure, initially starting as simple, symmetrical kind of activities, gradually combining movements together in more complex patterns, more similar to what would be used during embouchure. Some of these exercises can be done on the instrument, and gradually these exercises become sort of integrated into playing exercises with the help of music experts at the final stages. So in 2020 to 2021, I was fortunate enough to be based at the Institute for Music Physiology and Music Medicine in Hanover, in Germany, with Professor Altenmüller and supported by the Humboldt Foundation. So in this case, all musicians that came with an embouchure dystonia were diagnosed and assessed fully by Professor Altenmüller, and he collected baseline data, including videos of their playing performance. The embouchure dystonia patients that were felt to be appropriate for retraining were referred to me, and I could run through the protocol, do all the screening of the movements, and establish where their face muscle weakness and coordination was at. It was much more complicated than we originally intended due to this timing being around COVID. So there was a lot of online consultations. It was certainly not our intent. It was much more challenging than face-to-face, but nonetheless, it actually allowed a bit more accessibility. So the program was available to musicians from around the world. I'd spend 1 hour with them going through all the different components of the program and then review and progress exercises every 2 weeks for the first 3 months, then approximately every 4 weeks for the next 9 months. Patients at the end of this time, at the end of the 12-month period, completed questionnaires regarding their experiences, videos from the beginning and then the final stages were taken, and 2 expert neurologists reviewed these videos to discern whether they could detect differences in the embouchure. So as a few examples, the first series of exercises relating to facial muscles just ask the players to contract the facial muscles independently and on both sides. When we do it, you can see as one of the musicians showing, doing some single exercises, sometimes bilateral contraction, just trying to really feel they can contract that muscle without jaw movements, without compensatory movements anywhere else, just singular contraction, bilateral contraction of all the movements. From these simple movements, we start to get into slightly more complicated movements to try and retrain the patterning. So in this exercise, you can see an example of a very simple orbicularis exercise on the far left. Then in the second picture, we have the deep orbicularis still constricting, but we've added in levator labii superioris and some of the lower facial muscles to peel and hold some tension in the superficial layer of orbicularis, allowing a little more position like an embouchure would be. We then practice blowing through a straw to try and maintain that and make sure, using something like a chopstick for resistance, that the balance is the same on both sides in terms of muscle strength and control. We then go to other muscle groups. The first one was showing orbicularis and combinations. Then we can work on orbicularis with buccinator, the internal oral cavity constrictor. So using the person's finger in their mouth, they then close their mouth and push their inner cheek against their finger to get a good contraction going. And of course, we can use simple exercises like puffing air cheek to cheek. And there's a whole series of progressions that are in the program that go on to other forms of exercise. Again, to develop this strength in buccinator bilaterally, coordination with orbicularis, and then with the other facial muscles. So in the pilot trial of some of our patients that we saw, we did a 12-month follow-up. We used this very simple Likert scale to ask for their symptoms at the start of retraining, where they are today, and today being 12 months later, and how useful they found the off-instrument exercises. It was a 11-point Likert scale going from unable to play or not at all useful to normal concert performance or extremely useful. We can see the patients down here, a mixture of more males than females, which is pretty typical for dystonia. At the start of retraining, fairly low scores for everyone. And you can see that all of them had improved 12 months later. At this point in 12 months, not all of them, in fact, none of them were at their complete full concert playing. I have kept in touch with these people and they have returned to full concert playing in most cases at this point. It's taken another year to refine and do work in the orchestras and things to get that playing better. So it certainly takes time, but there are clear improvements and ability to do more playing within a year. Most of them loved the off-instrument exercises, and in fact, a lot of them reported wanting to use them themselves. So it certainly seems to have a lot of potential in improving embouchure symptoms. And as I said, now, at this point, knowing some of these players, many of them have returned to their professional performing now without having, in fact, I think they feel confident because they have some more control of their muscles. I thought it would be useful to see what the participants said themselves about their experiences. So one of them reported that what they thought the off-instrument training allowed them to do is to isolate, strengthen, and create new habits without the evaluative aspect of playing an instrument, which has so many ingrained habits. The muscle retraining process has been absolutely astounding. I have learned so much about the embouchure and the muscles involved, so they enjoyed it, despite perhaps initially being somewhat apprehensive because they are taught not to think about embouchure. Once I started physiotherapy exercises to strengthen balance both sides of my face, the shaking and trembling stopped completely. I also believe that the exercise and approaches would be of great benefit to musicians, and this person was a brass player, in apparent good embouchure health. I think the awareness and reinforcement of underlying muscular structures and actions would be significantly helpful in helping to prevent as well as moderate or reverse neuromuscular overuse injuries. It's very reassuring to know that I have a group of tools to address any issues that will come up in the future. I think this is a very common thing. The players feel empowered to look after their embouchure into the future. So what's next? Some of the players themselves set up the Embouchure Project. There's over 1,500 musicians who are members of the Embouchure Project on Facebook. There's a website as well. And the goal of this with myself and some of the musicians is to try and change the culture towards embouchure, to be supportive, to take away the stigma, to take away the fear, and sort of look at funding and trying to create more advanced training to really help people get back to play with this condition. Ideally, we also want to get education about embouchure with the young musicians to understand the anatomy of the face and breathing and muscles of the jaw and so on, so that they avoid getting problems in the first place. They feel they have more control over this apparatus. So we want to build knowledge within the community, hopefully get some resources to fund more training and get rid of the stigma around it to the point where it's not necessary to have such a thing as the Embouchure Project, so that we can actually move on and it's just a normal talked about topic where people are trained to look after their embouchure. So at the moment we're working on training therapists to do this retraining and seeking further funding to try and do this. But please feel free to join the Embouchure Project. This is again this player. After 12 months. Thank you very much.